All right, we're live.
All right. Good morning, everyone. It is March 31st. This is the Senate Health and Welfare Committee meeting. And today we're going to go through some of the bills that have come to us from the House and get an idea of what's in those bills. And then we can make a decision about how much more testimony we would like to take, who we'd like to hear from, and whether or not we want to actually pursue the bills that have come to us. So today we've invited the reporters of the bills and other interested House members, as well as our ledge counsel and a couple of folks just to give us some insight into the importance of the bill. So we're going to start with H104, and Representative Peterson, thank you for being with us.
Well, thank you, Chair Lyons, for having me, and committee. Thank you very much. H104. Oh, I'm sorry. Yeah. H104 is a strike all amendment. And the essence of what it does is it establishes a working group with a real long name. I'll read it. Facilitation of Interstate Practice Using Telehealth Working Group. So that working group will have 7 members. And what it's going to do is consider all aspects of the telehealth industry, looking at everything from out of country telehealth to interstate telehealth and all the licensing problems, legal problems, and so forth associated with it. And that committee or working group will report back by December 15th of this year to your committee and the House Healthcare Committee. And that's really the essence of the bill.
All right. Thank you. That's a good start for us. Just a quick question on votes in committee and on the floor.
It was 10-0-1, I believe was the vote, and I think it was unanimous on the floor. I
Okay.
can't believe it wasn't.
So a lot of controversy around this one.
Yeah. Well, you know, it has its genesis. The original 104 was attempting to provide telehealth around mental health issues. And what the purpose of that was if a provider and a patient were out of state and the patient moved to Vermont, they wanted to be able to keep the same provider using telehealth. And I know Jessa Barnard, who's on here, came to testify, and there were a number of problems brought up with that, and it was recommended that we strike that piece of it and start with a committee that would look at all aspects of telehealth. So that's kind of the background of it.
Good, that's helpful. I also see that Representative Houghton is here from the House Healthcare Committee. Laura, did you want to add, Representative Houghton, would you like to add anything? I know that you and Representative Peterson probably work closely on this bill.
Yes, thank you, Representative Houghton, House Healthcare Committee. I have nothing to add other than, you know, we've worked hard over the last couple of years on telehealth, and I think this is a good next step to really look at the licensing issues to ensure we're putting our best, you know, path forward and ensuring people have access to the providers they need to have access to.
Terrific. Yes, thank you. And I want to thank you both for your leadership in this area. I know the House Healthcare Committee is working very hard in the whole area of telehealth. We greatly appreciate it.
Thank you.
Okay. All right. So
a quick question, Senator Lyons. Thank you. Representative Peterson knows that we just came off a meeting where we talked about this as well. And I'm curious to know if there's any direction towards in the bill, I haven't read it, about reimbursement and parity for reimbursement.
This really doesn't speak to that. It considers all the issues. It considers, you know, impact and ethical considerations, whether to limit healthcare professionals with pre-existing patient relationships. I'm just reading now from the bill itself. Impact on state regulatory oversight and enforcement, effects on prescribing, differences between various states and U.S. territories, different policies for facilitating interstate practice, whether to explore the international practice of healthcare, and other issues relating to it. So Senator Hooker really doesn't get into specifics. I think what we can expect out of this is a broad outline of how we want telehealth and telemed to work, and the details will be worked out as part of that, I would think. Yeah, that was very interesting today earlier.
Yeah.
Okay, what was earlier? I missed it.
Pardon?
I was
What was
just
that?
wondering what your earlier meeting was, because that was.
Community health in Rutland.
Oh, neat. Okay. All right. I didn't realize
talk about.
Representative Peterson is another Rutland.
Yes.
Well, south of Rutland. Don't put me in Rutland. No,
Okay.
I'm kidding. No, I'm
Rutland
kidding.
County, Rutland County, Senator Lyons.
Okay, that counts. All right. Thank you. All right. So why don't we move along and have Ledge Council go through the bill with us, and then that may answer some of the questions that we have.
Senator Lyons, may I ask you a question, please?
Who is it?
Would you like, as Representative Houghton, would you like us to stay?
Look, that's completely up to you. If it might be helpful to
Okay.
answer some of the questions we have, but
Perfect.
you are not obligated to do that. I know you
Okay.
also have a
We'll stay.
committee meeting. Okay. All right. Thank you. Thanks for asking that. And I didn't recognize your voice. Apologize. All right. So Jen is here, as well as, is it Mitul?
Good morning, Senator. It's Mithil.
Mittel. Thank you. All right. So Jen, why don't you introduce Mittel to us, and then.
Great. So I'm Jennifer Carby from Legislative Council, and this is Mithil Patel, who is a BLS student clinician, who is, he's one of 3 student clinicians working with our office during this legislative session, and he is going to take you through the bill.
Terrific. Thank you. And Mithil Patel, welcome to the committee. I'll just introduce the members of the committee for you who are on Zoom. So Senator Hooker, Senator Hardy, Senator Cummings, and Senator Terenzini is unable to be here this morning, but he may or may not show up today. And I'm Senator Lyons, and it's nice to have you here. So we will turn it over to you to introduce yourself for the record and take us through the bill, please.
Thank you, Chair Lyons. Good morning. My name is Mithil Patel. I am a student clinician with the Office of Legislative Counsel, and I'll be walking us through H104 this morning. H104.
Mithil, I'm going to interrupt you for a second, just because Senator Lyons, I should have asked, do you want us to put the bill up on the screen? Mithil, we didn't talk about this.
That's a good idea. That's a very good idea.
Okay. Do you, are you able to share your screen, or do you want me to put it up and you can walk through?
I promise my internet would not allow me to do that. So
Okay.
I'm going to need you.
No problem. I will put up, let me just scroll back up to the top. I will put it up and then you do the walking.
Boy, don't we hear that every day about the internet?
You got it.
All right.
And committee members, if you have questions, you're just going to have to speak up, because I can't see you all. Thank you.
Okay, so thank you for that, Jen. H104 is an act relating to considerations in facilitating the interstate practice of healthcare professionals using telehealth. Section 1 relates to facilitation of interstate practice using telehealth working group and reporting. Subsection A discusses creation. So this creates the facilitation of interstate practice using telehealth working group, that would be the name, to compile and evaluate methods for facilitating the practice of healthcare professionals throughout the United States using telehealth modalities. Subsection B discusses membership. States the working group shall be comprised of the following members. First, the director of the Office of Professional Regulation. Second, representatives of healthcare professions associated with the Office of Professional Regulation. These representatives selected by the respective licensing board or the director. Third, the executive director of the Board of Medical Practice. Fourth, the representatives of the healthcare professionals licensed by the Board of Medical Practice, selected by the Commissioner of Health. Fifth, the representatives from the healthcare professional organizations. Six would be representatives of healthcare insurers, and seven would be any other interested stakeholders. This takes us to.
Can I ask a question? Can we go through the membership just really
Sure.
briefly? A question regarding beginning at number 4.
Okay.
Where it says representatives of healthcare professions. So it's by Board of Medical Practice and then other organizations. Is there a list? And I guess number 2 has the same thing with the OPR. Is there a list of, I guess we'll get to that when we hear testimony, but it is a question of how many folks that represents, how many organizations. So I'll wait until we hear from Lauren Hibbert and others, but I just wanted to identify that as a question.
Madam Chair, along those same lines, the definition of other interested stakeholders, I don't know how we define that or decide who that is.
Good question. Okay.
All right.
Yep. Thank
So
you.
we're no problem. Thank you, Chair. We are in subsection C now, powers and duties. So the working group shall compile and evaluate methods for facilitating the interstate practice of healthcare professionals, again, using telehealth modalities. This includes through the creation of telehealth licenses, waiver of licensure, national license compacts, and regional reciprocity agreements. In evaluating potential options for implementation in Vermont, the working group shall consider the following issues. There are 8. The first is impacts and ethical considerations related to patient care and the continuity of care. Second, whether to limit to healthcare professionals with pre-existing relationships. The third would be impacts on state regulatory oversight and enforcement. This includes fiscal impacts. Fourth would be effects on prescribing. Fifth is differences between various states and US territories in scopes of practice, qualifications, regulation, and enforcement. Sixth is different policy options for facilitating interstate practice, including the potential for reciprocity with healthcare professionals licensed in Vermont. Seventh is whether to explore the international practice of healthcare professionals using telehealth. And 8 is other issues relevant to facilitating the interstate practice of healthcare professionals. So subsection D refers to assistance. The working group shall have
Let's just stop right there briefly and see if there are any questions from
Sure.
the committee of clarification.
No problem.
I don't hear any voices. Okay, that's good. And there, as you're going through this, I'm jotting down some questions. So I think we'll all be getting to that with testimony.
For sure, no problem. Just let me know if you need me to slow down, Chair. Thank
Nope,
you.
you're good. So far,
Awesome.
so good. Thank you.
Awesome. Yeah, and then so a couple subsections left. We're at subsection D now, assistance. So the working group shall have the administrative, technical, and legal support of the Office of Professional Regulation. Subsection E refers to reporting, as was already mentioned, on or before December 15th, 2021. The director of the Office of Professional Regulations shall provide the working group's findings and recommendations to 4 committees, 2 in the House, the Housing Committee on Healthcare and on Government Operations, and the Senate committees on Health and Welfare and on Government Operations.
So I guess it does raise a question, and I don't know if any of our House folks are here or if you know. Did this bill visit GovOps in the House in any way? No.
This is Representative Houghton. No, it did not.
Okay. All right. Did they look at it at all or? Okay. Just checking. Thank you.
Thank you, Chair. And that would take us to the last subsection, which is subsection F, meetings. The Director of the Office of Professional Regulation shall convene and serve as the chair of the working group and shall call the first meeting to occur on or before July 1st of this year, 2021.
Okay,
And finally, we have our last section, effective date and the actual take effect on passage.
okay. Any questions for Mithil? Mithil, I didn't say that right, sorry.
Nice
Why don't,
job.
why don't we take the, that's good.
Thank you.
Questions? All right,
So
go ahead, Senator Hardy, and then Senator Hooker.
I don't have a question for Mithil, but I have a question for Lauren Hibbert. Are you testifying, Lauren, or are you
Yes.
just here in case we have, okay, I'll wait till you
Yep,
do your
yep,
actual
she's on the
testimony.
agenda.
Okay, thanks.
So yes, we have both Jessa, this is our first dive into the bill. And we have Jessa Barnard and Lauren Hibbert here. And we can decide how much more testimony we'd like as we go forward. Okay. Questions for Ledge Council? Senator Hooker.
I'm just wondering about talking a little more about what the direction of the working group is going to be. And it sounds as if it's going to be to collect data, to find maybe best practices, that type of thing. And I'm curious to know if there's any compensation for the members of the committee. I didn't see any money in this bill.
Well,
No compensation
yeah.
is provided. It's all people who are either serving in official capacities or serving voluntarily because they have an interest, but there's no compensation.
Okay, thanks.
Any other questions? Clarifying questions? All right. Okay, so I can see that some of the questions that I have are going to be answered from the two people who are testifying, and we maybe not. We'll see. Thank you very much. That was great. Good walkthrough. Appreciate it. Okay, so I think Jessa, you are up next, and I see Mike Fisher is also here. Mike, did you have an interest in this bill as well as H430? He's not here. Okay. Yes, there you are. You're muted.
I am here for 4:30, but
Okay.
I would have a sentence or two to say about this bill if you
Terrific.
want.
Okay, well, we'll put you on after we hear from Lauren Hibbert. All right. Okay, so we'll move to Jessa Barnard. Thank you, Jessa, for being here.
Thank you. Excuse me. Thank you very much for having me. Jessa Barnard, the Executive Director of the Vermont Medical Society, and we represent several of the professions who would be impacted by this work, which is why we strongly support the bill. So we represent MDs, physicians licensed by the Board of Medical Practice, osteopathic physicians licensed by the Board of, or the Office of Professional Regulation, and physician assistants licensed by the Board of Medical Practice. So professions in both camps there. And we support this bill really seeing at it as one of the post-COVID lessons type bills. What can we take from what we've learned from the pandemic and bring forward to try to facilitate the future of medicine? We think these issues around telehealth licensure really deserve more of a look. So just to really put a finer point on it, this really came from the perspective of the licensure requirements for the interstate practice of medicine, not the whole world of telehealth regulation. Even the interstate practice of telehealth gets complicated with things like credentialing and getting reimbursed and malpractice insurance. And that's, I think, probably outside the scope of this working group. This is really focused on where and how do you get licensed to care for a patient that's located in another state. And that's where the bill originated from for one subset of professions around mental health counselors. And so Our testimony in the House actually wasn't opposed to the bill. It was more saying this needs to be a lot broader. This impacts every healthcare professional, everyone providing telehealth services. We've learned through the pandemic that a lot of states streamlined the requirement, you know, as I'm sure you recall from your work on the various telehealth bills, the non-pandemic state of regulation is that you have to be licensed in the state where the patient is located. And so that raises all sorts of complex issues for audiovisual telehealth, for phone services. You know, the patient, if they're traveling on vacation, how do you provide that care? If they are a college student and they've gone back home, or they're at school and you're in a different state, can you continue to care for your patient? And so for the pandemic, there have been a lot of temporary changes to that licensure structure. There have been different states have taken different approaches, whether it's totally waiving licensure, whether it's getting an emergency license, whether it's registering. And some states have looked at this in the kind of permanent non-COVID state as well. Florida, for example, has a telehealth, like sort of a streamlined telehealth licensure provision. I believe Maine does. But it's an issue many states are looking at. We've had conversations with some of the New England states, and it raises, while it sounds like a great concept, and I think it potentially may be, there are a lot of complexities. You know, what do we do about where the professional gets disciplined? What about prescribing? What about, how does the patient know where to make a complaint? So it's not a simple solution necessarily, but I think there are some options. You know, there are, for example, this is where interstate licensing compacts came from. You've passed the physician licensure compact, so that's one method of approaching it. But that solves some of the concerns. If you know half your patients are in Vermont, half are in New Hampshire, you could just be licensed in both states or use the interstate compact licensure system. But if your patients out of state for 2 weeks in a different state you didn't know they were going to be traveling to, that doesn't necessarily solve that time limited complication. It also gets really complicated because Vermont, you have control over professionals providing care into Vermont. So say a Florida physician wants to care for a patient who's in Vermont part of the year. The laws you change could make it simpler for that Florida clinician to care for the patient located in Vermont. Unfortunately, from my perspective, you don't control what regulates a Vermont clinician trying to follow a Vermont patient out of state. So there may be reciprocity issues we want to look at, because if we think we want to make it easier for somebody to provide care for a patient into Vermont, we also want it, personally, I would like it easier for the Vermont clinician caring for an existing patient who may be on vacation or out of state for school to be able to care for their patient in the other location. So do we want to solve it in a two-way method? So because of that and because of these complexities, we really support this work group approach. We would love to participate in the work group. We think the House included the necessary provisions and members of that work group. You know, I know you raised some questions about the number of representatives. I think, and Lauren can speak more to this, OPR's convened a number of work groups, and I haven't found the number to be too large or overwhelming. I also think this is kind of a niche issue. Again, because it's limited to the licensure and regulatory issues, I don't think it's going to be the whole world of anyone interested in even just telehealth. So I think it would be manageable, but I could let Lauren comment on that as well. So with that, I really thank you for taking up this bill. I think these are really important issues. I know not just VMS, but the Hospital Association, Bi-State Primary Care, a number of other healthcare organizations are really interested in these issues and would like to see this move forward. So thank you.
All right, good. Thank you. That's comprehensive and comparative with what happened in the House. Appreciate that. Questions, committee? Okay, so I guess you did hear the question about the number of people involved, and I think Senator Hardy's question about other interested parties. You've mentioned a few, so I guess we understand. So FQHCs, others.
Exactly, and they may fall under the categories of associations representing healthcare professionals. There may be people who kind of wear multiple hats. I don't expect there to be a overwhelming outcry of other interested stakeholders wanting to join this work. But I think at least on the House side, we felt like there wasn't a need to limit it to specific named organizations or professions, that if there were other groups who ended up being interested in the topic, they could participate and share their feedback as well.
Okay, and the charge to the committee you feel is narrow enough and appropriate to the goals?
I think so, because it limits it to the interstate practice of telehealth. It's really, that's the word that's saying this is about between jurisdictions or locations, what are those issues that are raised? It's not just kind of the practice of telehealth within Vermont and all the other types of issues that may bring up.
Okay, thank you. Questions, Senator Hardy?
Yeah, thank you, Madam Chair. My question about the membership on the working group is, I guess what it seems like is it's much more of an informal working group than the sort of formal working groups where we name people and then we say in consultation with blah, 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 blah. So I guess from a logistical perspective, both Jessa and Lauren, you can weigh in when you testify on this, like, is this organized enough to be able to manage it, or is it going to be kind of like herding cats? Given the short timeline, would it be helpful to have it better defined who has a seat at the table, or would it hinder the ability to make sure everybody gets their voices heard? I just want to make sure that if you're going to do this work, it's done in a way that you can manage over the 7 months or 5 months or whatever ends up being, and with it less defined, does that make it easier, or does that make it harder?
So it'll be Lauren who will be convening the group, so she may have more to say on that. I will say, as a participant in some of other OPR task forces, for example, there's been an ongoing one around compounding and dispensing of medications that I think was set up somewhat similarly. It's been, from a participant's standpoint, I think it's worked well. It has occasionally been different people at different meetings. I think it's often a challenge to get professionals themselves, the licensed professionals who are able to attend daytime work group type meetings. So you may not get everyone at every meeting, but at least then they have an opportunity to weigh in if they can attend one of the meetings. And it's been, I've found the opportunity to have my voice, have my input, and then OPR kind of takes all that feedback and really synthesizes it and is the one to pull it together into a product. So I think it's worked well. And actually, there was another work group around pharmacy prescribing that was somewhat similar. So I think they've worked well and allowed anyone who wants to provide feedback, so it doesn't feel limited in who's able to attend or weigh in, but not so big that it's unmanageable or unwieldy.
Okay, that's helpful. And my second question is, you referenced in your testimony the Physicians Interstate Compact, which I wasn't here for, so I don't know the full scope. I haven't looked it up, but we just passed, at least on the Senate side, the nurse compact, licensure compact. And my understanding that if that were to become law, then nurses could participate in telehealth across state lines for the states that are in the compact if they have a compact license.
Exactly. And yes, and so compacts help, but I guess the shortcoming of compacts is that you still need to know ahead of time that those are the states your patients may be located in. Typically with a compact, you still need to say, okay, I'm in Vermont, I'm primarily located in Vermont, but then I also want to be able to practice in New Hampshire, Massachusetts, Maine, and Connecticut. But if you have a patient who happens to then be going to school in Florida and you didn't know it until 2 weeks ahead of time, the compact may not really serve that time sensitive purpose. Often and I think the nurse compact is different in this regard. With the physician compact, you still need to pay the full licensure fee in each state in which you're licensed. So it may not be as simple as just saying, let's just get a compact license in all 50 states, because that's fairly complicated. You still, whatever product comes out of this may not solve some of these issues, or we may not actually in fact want to, but you still need to comply, for example, with CME requirements in every state where you have a compact license, and opioid prescribing rules in every state. So there are still state-specific requirements that make it challenging to say it's just as easy to get a compact license in you know, for example, every state in the country, so you can serve your patient wherever they're located. So I think compacts are definitely a step in the right direction, and we fully supported the physician compact. I think it's good to adopt the nurse compact, but for telehealth purposes, it may not be all the flexibility we would like.
Okay, and there are obviously other practitioners too that don't fit under
Exactly,
compact.
exactly. And and as you said, not all states have adopted the compact. For example, California probably never will. So what if your patient's located in California? So those are some of the shortcomings of a compact structure.
Okay, great. Thank you.
Yeah, good question. I was going to ask Lauren the question about the physician compact that we passed a few years ago. Any other questions for Jessa? Okay. Thank you, Jessa.
Thank you very much.
Terrific.
Thank you for taking up the bill.
Yeah. Lauren, thank you for being here. Why don't you introduce yourself? We don't have anything on our webpage from you, but it seems like you might have something to put up on the screen. No?
I do not have anything to put up on the
No,
screen.
that's fine then. Go right ahead.
For the record, Lauren Hibbert, Director of the Office of Professional Regulation. Thank you for having me in today and for taking up this bill. The Office of Professional Regulation strongly supports H104. The bill as originally drafted was specific to licensed mental health counselors, which is one type of mental health counselor that the Office of Professional Regulation oversees. I just was looking at our list of professions to try to summarize for you guys the scope of health professions that the office oversees. I won't go through a detailed list. Maybe that would be something that I could submit in writing to you, but it's everything from dietitians to licensed drug and alcohol counselors, social workers, obviously all of the nurses, osteopathic physicians, naturopathic physicians, chiropractic physicians, acupuncturists, psychologists. It's a very large group of people. And some of the professions are really well established, and not that the others are not well. I'm not denoting any inferiority by saying that the others are not as well established, but physicians, osteopathic and allopathic, that profession has existed for a very long time, has very robust regulatory structure, association structure, national network structure. Dietitians, they will never have a compact that will come in front of you to consider. It doesn't mean that they don't practice telehealth. And one of the reasons why I particularly like H104 is that I think it's starting to, it's asking this working group to come up with a state concept of how telehealth should go forward as we unwind from the pandemic. And I can see from the emails that I'm receiving from all of the associations and regulatory board associations that this is a very robust conversation. I think the seas are going to be choppy as, that's the best way that I can summarize it. I think the seas are going to be choppy as we unwind from COVID. I think a lot of states did the very best. I think our legislature did the best in the nation with its combination of emergency licenses, roster on the web pages for certain groups, and deemed licensure for some groups. We really did the ultimate hybrid of how other states have approached telehealth in the COVID pandemic. And I think with each solution, it was really targeted to the specific group. What do we need to feel safe? And what do we need to get this person working? But we know this will change. And we know now that the communities, the healthcare providers, the facilities, the employers, to an extent, the health insurers are all going to have an interest in this continuing. So the work group, I think, is essential. I was trying to express this on the House side. I think I did, and I hope it's reflected in the language adequately. I think that it's very likely this work group will come up with initial recommendations for the legislature. and then have further work to do. I think this topic is so large, and so many things will be changing in the next 18 months from a regulatory and legal framework that we'll have to keep working. Some of the concepts such as reciprocity, if we want to do a reciprocity agreement with our sister states on the Northeast, that is something that we have talked about at OPR for 10 years. We've talked about it for 10 years because it's very challenging, because we'll have to come to you as the legislators and then start to work with legislators with you in these other states to come up with how this will work. So I do not want to promise that I'll have a solution for you after convening this work group in December. So just please, I'm on the record. I'm not promising a solution. I'm promising a thorough investigation of all the issues and illuminating some places where we need to continue working. In terms of the membership of the working group, I have heard from the Commissioner of Mental Health. She would like to be on the list, either the Commissioner of the Department of Mental Health or designee would be my ask for that, the added language for her. I think that makes sense. Obviously, the Department of Mental Health has a perspective on this. And we know this because mental health providers have a very frequent need for telehealth. So they use telehealth very frequently because their practice is really tailored to be, it's, you know, less diagnostic, hands-on diagnostic, and more talk. So we know that mental health providers will utilize these provisions more than others. So that's my one request for additional members as an added an amendment by this committee. Other interested parties, I do think you could consider striking, but if you do, I would ask that you put in by meetings that they will be public. We would have done that anyway, but we, by default, we have all of our meetings public, but I think that that would give folks some assurance that they're always welcome at the table. And I appreciated Jessa's statements about our previous working groups. We do work very hard. Sometimes we make mistakes, as we're human, but we do work very hard to include everybody at the table. For this particular group, almost every licensee group has an association. Some are robust and some are a bit less robust, but we would make direct contact to all of the professions and their associated associations. So that would be our strategy, and certainly our first meeting would be talking about scope, structure, membership, and making sure that the word is spread widely. We will have a webpage on our website for this work group. That's something that we've learned is that is helpful so that there can be a central location for documents, meeting schedules, etc. We have not done that for a working group yet, but we will do that for this working group. And in general, I just want to say I'm really excited for this work. I think that this is exciting and is something that could help shape how healthcare is delivered in the state for a long time. And I'm excited to be able to chair it.
Thank you. That's great. I do have a couple questions. One is the webpage isn't referenced in the bill. Is that something that would be helpful to you or not to have it referenced?
I don't need it to be referenced. It will happen. But if it would make you feel more comfortable, I'm happy for you to reference it.
Nope, I'm comfortable with it just as it is. But I do have a question. You mentioned the interested parties piece, and I'm wondering if rather than having that sort of global membership, if we put something in like take that out and just say that the working group will reach out to other interested parties as needed, something like that.
I think that would work well,
Okay.
Senator Lyons.
Yeah, okay. So we might consider that at least as a committee. Then the other question I have for you is the charge to the working group, and is that laid out effectively enough for you to accomplish the goals that you would like to accomplish and that you think are important in terms of licensure? But we will go through those together, I think, to ensure that we're comfortable with those, but we need to know from you if they're comprehensive and sufficient.
I do believe they're comprehensive. I will think about it more diligently while you're considering, and if there's additional recommendations, I'll make them. But I'll say that Jennifer Carby, Jessa, and I spent some considerable time on this language in a collaborative way, and I appreciated it. The reflections, Jen really put every item that was a concern of mine walking into House Health. And I did walk into House Health not supporting the previous version of the bill, saying, please don't do this. And please think of all the ramifications that this will create. And we really need to slow down and think of these concerns. So a large one for me with clinical mental health is if there's a provider from Florida providing care to a Vermonter, and that Vermonter is suicidal, how does the Floridian know how to connect that person to Washington County Mental Health? So I had some very practical concerns about that particular profession and that particular, just allowing anyone who's licensed in any state to provide care to Vermonters. I was really concerned about the quality of care and the things that we are supposed to consider under C really encompass the majority of my concerns. One of them, because I am responsible for these professions' budgets, of course, is money. This committee knows that OPR is all special fund. It's all supported by licensee funds. So if we touched on this with the Nurse Compact, because the Nurse Compact is structured so differently than the Physician Compact, if we start allowing anyone who's licensed in another jurisdiction to provide care here, then the state loses revenue. So for instance, now there's an app called Headspace where you can get mental health counseling, and it should be provided by somebody who is licensed in the state of Vermont if it's a Vermonter accessing that app. And Vermont is paid revenue for the providers of the Headspace app. So I'm not picking on Headspace, just for the record. I'm just saying that we are in a place where people's care is far more complicated than it was even 3 years ago and even 18 months ago. 18 months ago, it was clear. And because of all the statutory changes that have happened during COVID, it's become less clear and more murky. And I think we just need a very measured, comprehensive group of folks, smart folks, to come together and really look at all of the issues in a structured way. And I do think that OPR has the capability to lead this group and to try and organize and herd the cats, as Senator Harvey said.
Right.
I like the cat, so.
As you're speaking, of course, all these other little questions come up, but just to step back, would it be helpful or not to include reference to the interstate compacts that we have?
I think we could. I think they're referenced by implication because we are supposed to look at trying to figure out which
your various states and U.S. territories. I see that.
So if I can jump in, Madam Chair,
yeah, sure.
On page 2, under the powers and duties, one of the things that it talks about is looking at the creation of telehealth licenses, waiver of licensure, national licensure compacts. So I think they're already directed to look at national licensure compacts and the extent to which they may be useful or not useful in this area.
Perfect, thank you.
And there are compacts, Madam Chair, that the state has not adopted. The Psi Pact, there's
Right.
there is a physical therapist compact. I'm sure there will be additional compacts forthcoming as we continue to move through this. It's interesting, a lot of the compacts are supported by the Department of Defense, and they just announced a whole list of compacts that they are trying to initiate. I forget the profession. Some of them are OPR regulated professions, and I'm a little embarrassed that I forget the professions off the top of my head because I really should be paying attention to that. So
I think I saw that it comes out in their little newsletter. Department
yes.
of just happened to see it, but I don't remember either.
I know teachers and massage therapists and another profession.
So the other question that is raised by this, of course, and you've said you're trying to exclude everything except licensure, but of course the whole area of insurance coverage and extending from health insurance to liability coverage and so on becomes a question as licensure. Maybe licensure gets resolved, but then it will open up another whole arena for conversation. But that's not what we're looking at in this bill.
I would ask that you not require us to look at that. The health insurers are a participant in the work group. I suspect that insurance will be a large footnote, if not multiple footnotes, in our final report as a place where we need to continue inquiry. But I think that topic is larger than we can chew in the 7 months that we have.
Thank you. Okay. Other questions for Lauren? So you're supportive of the bill. You've made a couple of possible suggestions for us, or you've made one, and then you've helped identify number 2, which is the stakeholders. I think we can certainly modify both of those. We'll have to touch base with Commissioner Squirrel about her membership and making sure that that works for her.
I did exchange communication with Shayla Livingston, who now works for the Department of Mental Health. And she has said that that is the commissioner's preference.
Unfortunately for us, and we're going to have to confirm that. We absolutely trust you. But we'll confirm it in one way or another when we have Commissioner Squirrel, and it may be a simple and easy communication. But thank you. Thanks for bringing that up. That helps. Anything else, committee, for these two? Okay, so Mike Fisher, you're here, and we have a little bit of time, and you're welcome to comment on the bill briefly. So go right ahead.
Thank you, committee. Mike Fisher here. I did not ask to testify in the House committee.
And you represent?
I am Mike Fisher, the healthcare advocate.
Yeah.
Thank you. I did not ask to testify on this bill in the House, and am supportive of the effort. I have I think a minor point. Just recognize, as I listen today, as I sit around the outside of the room, Senator, that there is not a consideration of a consumer voice. It's different to be on a committee than it is to have a committee be open that one can show up to. And I am not requesting that the healthcare advocate in any way be named to this committee. I'm not convinced that it rises to the level that we're able to put the staff time into it. It may, in which case, in my experience, Senator Hardy, I think, when it says other interested stakeholders, if we said we want to be on a committee, we would get to be on a committee. I would be surprised if that wasn't the case. but I do think that there is something missing in the bill, even if no healthcare consumers show up to be on the committee. I think including some language that including other healthcare consumers to be on the committee would be a positive addition to the bill. And that's my one comment.
Okay, thank you for that comment.
And then I should say, by the way, in my experience, healthcare consumers are passionate about telehealth in every possible direction you can imagine. Very, very positive, very, very negative.
Right.
And if you can believe it, passionate about their ambiguity about down the middle. So it wouldn't surprise me if there is some interest.
Well, I guess the question will be whether that is someone added to the working group itself. And I'm gonna turn the question over to Lauren at this point, but then it might be something that we take up as we go forward with a bill. And then I see Senator Hardy, you do have a question. I got that. So adding the consumer voice, Lauren, do you want to comment on that?
Sorry, I thought I was muted there for a minute. My only concern is how to reach them. And my solution that jumped to my mind is on our boards, all of our boards, we have at least 2 public members. So I was thinking perhaps a modification of the stakeholders to on B2 and B4, that there be some recommendation that at least one of the representatives of the healthcare professions associated with the Office of Professional Regulation, or 2 or 3, or however many the committee decides, are public members of our respective boards. I'm not saying that they are ideal substitutes for consumers because they are associated with the professional board, and they all are human, so they have their own perspective on how they've had healthcare delivered. I would love for the healthcare advocate to be a member of the work group. I would open, that would be fine. I would welcome that. But I heard you say that you may not have the bandwidth. So if there is an identifiable group, that would be phenomenal. I don't know how I would notify consumers of healthcare that this work group is happening. That seems hard to accomplish. So
yeah. Okay, so here's my suggestion, because Senator Hardy does have a question, but my suggestion is for, if you don't mind, I'll send this both to Jessa and to Lauren, and perhaps we can reach out to the Board of Medical Practice through you, Lauren, and then Mike, you consider how best to add this language, if at all, where it fits in the bill. So you've made one suggestion, but do think about it. And when we come back to the bill, maybe we can resolve that as an issue, be helpful. And you can probably hear the jets today. This is the 3rd time they've gone over. So there we go. Senator Hardy, you had a question.
Yeah, thank you, Madam Chair. Well, first of all, the term healthcare consumers, this still rubs me the wrong way. I mean, aren't they patients and people? I don't know. Healthcare consumers seems like a very kind of, I don't know. I don't like that term. But my question was similar to, Senator Lyons and also Lauren's, is who would this be as the representative on, if it's not you, Mike? And so I appreciate the chair's suggestion that you all sort of put your heads together and figure out how to get that included on the committee, because I think it's really important. One possibility, it wouldn't be sufficient, but one possibility to add would be a public hearing of patients who have passionate views of public health. So you can collect testimony, and you put out the word through all of your associations and through the healthcare advocates office or whatever. And so you could just hear from everyday patients and their experience with telehealth. But that may not be sufficient because they wouldn't be actually at the table all the time, but that's just an idea I just thought of for you to consider. But I like the possibility of the three of you or whomever coming up with a way to include patients on the work group, or their voices, their concerns.
Yeah,
Could
I mean, yeah, go ahead,
sorry.
Lauren. Yep. Sorry.
We could absolutely collect public comments. That is something that we do through rulemaking. It's just getting the word out that we are accepting public comments, and without money for advertising, this bill doesn't, I'm not particularly interested in you attaching money to it. I'm not advocating that you do, but without money for advertising, we'll have a hard time getting interested people. You know, if we had a Front Porch Forum budget, then we could advertise on Front Porch Forum and get quite a few comments. I'm confident. But absent that budget, I don't know how we would get the word out.
So we're not going to add money to this bill yet, unless we hear from you that we should do that. It will extend its journey through the Senate. The other thing is, maybe I do ask you to consider what works in terms of the healthcare consumer without liking the term either. But so to think about what would help, if it helps. Remembering that this is a working group bringing information back to the legislature, where we have public input all the time. So just think through all of the steps, and then the folks who might be engaged. So that's good. So thank you for this. I think we've got a good beginning to the bill, and unless I hear differently from the committee, we'll continue to work on the bill. We might ask Jen to make some improvements to it. Jen, I think you've heard a couple of comments today, and when we come back to the bill, we'll talk about those comments. And I didn't mean to leave you out, Mithul. We'll have you come in to follow up with the bill. I think it's actually your responsibility. So as long as Jen is agreeable, and we look forward to having you work with us.
Yes, thank you, Senator Lyons. That would be my plan, to have Mithul work with me on any amendments that you do.
Thank you. All right, terrific. Okay, so we are going to move along to the next bill on our agenda. I had hoped to take like a 1-minute break, and I'm going to suggest that we do that. I'm going to take a 2-minute from 10 o'clock to 10:02, so we'll be 2 minutes behind. And then we'll dive into H430. So we get a 2-minute stretch. Nellie, we can just hold right here and come back.